If you're over 60 and you've started noticing odd sensations in your hands or feet, you're not alone. A slight tingling that comes and goes, a numbness that wasn't there before, maybe a burning or buzzing feeling that's hard to describe, but impossible to ignore. For many older adults, these changes appear slowly, so slowly that they're easy to dismiss at first, until one day you realize they've become part of daily life. What's frustrating is that when you bring this up, you're often told it's just part of aging. You might be reassured that it's common or that nothing serious shows up on basic tests. And while that may be true, it still doesn't answer the real question most people have, which is what can actually be done to support nerve health before the problem gets worse. As we age, the body changes in ways that aren't always obvious. Digestion becomes less efficient. Nutrient absorption isn't as strong as it once was. Certain medications can quietly interfere with how the body uses essential vitamin. Over time, these small shifts can affect how nerves function, even if everything else seems normal on the surface. This is where something many seniors are surprised to learn comes into the picture. There is a very common, affordable vitamin, often costing around $15 or less, that has been discussed for years in relation to nerve health. It isn't new and it isn't rare. Yet many people say no one ever explained its role to them until they went looking for answers on their own. The reason isn't a conspiracy or a secret. Healthcare systems are built to respond to symptoms once they become disruptive. Nutrition, especially in older adults, is often addressed only after a clear deficiency appears. By then, discomfort may already be affecting sleep, balance, or daily activities. This doesn't mean there's a quick fix or a guaranteed solution. Anyone promising instant results isn't being realistic. But many seniors find that when they understand how nerve health is supported and address gaps early, everyday sensations can feel more manageable and less unpredictable. In this video, we're going to take a calm, realistic look at why nerve issues are more common after 60, how this inexpensive vitamin fits into the bigger picture, and what older adults should know before making any changes. The goal isn't hype, it's clarity so you can decide what makes sense for you. As people move past 60, changes inside the body begin to affect nerves in ways that are gradual and easy to miss. Nerves rely on a constant supply of oxygen, nutrients, and chemical signals to send messages between the brain and the rest of the body. When we are younger, the system is resilient and quick to recover. With age, that efficiency slowly declines, even in people who otherwise feel healthy and active. One major reason nerve issues become more common later in life is reduced circulation at the microscopic level. Tiny blood vessels that feed nerve endings can stiffen or narrow over time, delivering slightly less oxygen and fewer nutrients than before. This does not usually cause sudden pain. Instead, it leads to subtle sensations such as tingling, mild numbness, or sensitivity to temperature, especially in the feet and hands where circulation is naturally weaker. Another factor is how the body processes and absorbs nutrients. After 60, digestion is often less efficient than it was decades earlier. Stomach acid levels may decrease, enzymes may be produced in smaller amounts, and the gut lining may not absorb vitamins as effectively. Even when diet stays the same, the body may receive less usable nutrition. Certain vitamins are particularly important for nerve signaling and insulation, and when levels gradually drop, nerves can become more vulnerable to irritation and misfiring. Medication use also plays a quiet but important role. Many older adults take prescriptions for blood pressure, diabetes, cholesterol, or stomach issues. These medications are often necessary and beneficial, but some can interfere with nutrient absorption or alter how nerves respond to signals. Over time, this can contribute to nerve discomfort without being immediately obvious or directly linked to a single cause. Normal wear and tear is another contributor. Nerves are long, delicate structures, and decades of movement, posture habits, minor injuries, and repetitive stress can slowly affect them. The spine, in particular, changes with age. Just lose moisture, joints stiffen, and small compressions can develop, subtly affecting the nerves that branch out to the arms and legs. These changes often progress without dramatic warning signs. Inflammation also tends to increase with age, Even low-level chronic inflammation can make nerves more sensitive and reactive. This can amplify sensations that once would have gone unnoticed, turning minor signals into persistent discomfort. Combined with slower nerve regeneration in older adults, this makes recovery take longer than it once did. What makes nerve issues after 60 especially frustrating is that they rarely come from one single cause. Instead, they develop from the accumulation of small changes over many years. Each change on its own may seem insignificant, but together they can alter how nerves function day to day, leading many seniors to feel that something is off even when standard tests appear normal. As people age, the body's relationship with nutrients changes in subtle but important ways, especially when it comes to nerve health. Certain vitamins are essential for maintaining the protective covering around nerves and for helping electrical signals travel smoothly from one cell to another. When levels of these nutrients are steady, nerves tend to function more predictably. When levels slowly decline, communication between the brain and the body can become less efficient, leading to sensations that feel unfamiliar or uncomfortable. One reason this happens is that older adults often absorb vitamins less effectively than they did earlier in life. Even when someone eats a balanced diet, the digestive system may not break down food as thoroughly or transport nutrients into the bloodstream as efficiently. Over time, this can lead to borderline deficiencies that are not severe enough to trigger alarms in routine blood tests, but still meaningful enough to affect how nerves behave on a daily basis. Another issue is that symptoms linked to vitamin-related nerve support can be vague and nonspecific. Tingling, numbness, sensitivity, or a feeling of weakness can be attributed to aging, circulation, posture, or stress. Because these sensations develop slowly, they are often normalized rather than investigated. This means the underlying nutritional component may go unaddressed for years, even though it plays a role in how nerves are functioning. Cost is not usually the barrier. Some of the vitamins discussed most often in relation to nerve health are widely available and inexpensive. The challenge is awareness. Many people assume that if something were important, it would automatically be emphasized during routine checkups. In reality, healthcare visits are often focused on managing existing conditions, monitoring major risk factors, and adjusting medications. Nutritional support tends to be discussed only when a clear deficiency is identified or when symptoms become more disruptive. Lifestyle factors also influence vitamin levels as people get older. Reduced appetite, dietary restrictions, and changes in food preferences can all limit intake of certain nutrients. Some seniors eat less protein, fewer fortified foods, or avoid entire food groups due to digestive discomfort. Over time, this can further narrow the margin between adequate and suboptimal vitamin levels, particularly those involved in nerve maintenance. What adds to the confusion is that vitamin-related nerve support does not work like a pain reliever. It does not mask symptoms or produce dramatic sensations. Instead, it supports internal processes that help nerves maintain their structure and signaling ability. Because of this, changes tend to be gradual and subtle, which can make it harder for people to connect cause and effect without clear explanation. Understanding this helps explain why an affordable, commonly available vitamin can be overlooked for so long. It is not that it is ineffective or unimportant, but that its role is quiet, supportive, and preventive rather than dramatic. When seniors finally learn how nutrient levels affect nerve function, many realize that the issue was never about chasing a quick solution, but about recognizing a small missing piece in a much larger picture of aging, nutrition, and long-term nerve stability that often goes unnoticed until discomfort becomes hard to ignore, and daily sensations no longer feel as steady or familiar as they once did, even though nothing obvious seems wrong and everything appears normal on the surface. Many older adults are surprised to learn that something so simple and affordable can be overlooked for so long, especially when they regularly see doctors and follow medical advice. The reason this happens has less to do with neglect and more to do with how modern healthcare is structured. Most medical systems are designed to diagnose and manage clear diseases, not to track gradual functional changes that develop over decades. Nerve discomfort that builds slowly does not always fit neatly into a diagnostic category, so it often falls into a gray area where no urgent action is taken. Doctors are trained to prioritize conditions that show up clearly on scans, blood work, or physical exams. When test results fall within normal ranges, even if a patient feels ongoing discomfort, there may be little clinical justification to intervene aggressively. Subtle nerve-related symptoms that are influenced by nutrition, absorption, and long-term wear do not always trigger clear red flags. As a result, conversations often shift toward monitoring rather than addressing underlying contributors. Time constraints also play a role. Appointments are short, and physicians are often managing multiple chronic conditions at once, such as blood pressure, blood sugar, heart health, or joint pain. These issues understandably take priority because they carry immediate risks if left unmanaged. Nutritional discussions, especially about vitamins that are available over the counter, may be postponed or omitted simply due to lack of time rather than lack of importance. There is also an assumption built into healthcare that if someone were deficient in a key nutrient, it would be. In reality, many vitamin-related issues exist in a middle zone where levels are not low enough to be classified as deficient, but not high enough to optimally support nerve function. This borderline state can still affect how nerves behave, yet it is rarely addressed unless a patient specifically asks or symptoms become severe. Another reason this topic is often overlooked is that vitamins are not treatments in the traditional medical sense. They do not act like prescription medications that target a specific symptom or condition. Instead, they support foundational processes in the body because their effects are supportive rather than corrective. They do not produce immediate dramatic changes that are easy to measure in a clinical setting. This makes them less visible in outcome-driven medical models. Older adults themselves also play a role without realizing it. Many people assume that if something were relevant, their doctor would automatically mention it. Others hesitate to ask about supplements because they worry about seeming self-diagnosed or uninformed. Over time, this mutual silence allows potentially helpful information to remain unspoken, even when it could make a meaningful difference in daily comfort. What all of this creates is a gap between how nerve health actually changes with age and how it is typically addressed. The vitamin itself is not hidden, expensive, or experimental. It is simply quiet, supportive, and easy to miss in a system focused on acute problems rather than long-term maintenance. Understanding this helps explain why so many seniors only discover its relevance later than they wish, after months or years of wondering why something feels off and why no one ever explained that small cumulative factors can matter just as much as major diagnoses when it comes to how the body feels day to day. When older adults begin thinking about adding something new to their daily routine, especially a vitamin or a supplement, uncertainty is natural. There is often concern about safety, interactions, and whether it will actually be useful or just another unnecessary expense. This hesitation is understandable, particularly for people who already manage multiple medications or health conditions. Making informed decisions becomes more important with age, not less. One of the most important considerations is understanding that vitamins meant to support nerve health are not designed to replace medical treatment or cure underlying conditions. Their role is supportive, helping the body maintain normal processes that can weaken over time. This means expectations need to be realistic. The goal is not instant relief or dramatic change, but gradual support that fits into an overall approach to health. It is also essential to consider how individual circumstances affect suitability. Factors such as existing medical conditions, current medications, and known deficiencies all matter. What may be appropriate for one person may not be appropriate for another. This is why discussing any new supplement with a healthcare professional is always advised, even when the product is widely available and considered low risk. Personalized guidance helps reduce the chance of interactions or unnecessary use. Dosage is another area where caution is important. More is not always better. Some vitamins can build up in the body if taken in excessive amounts, while others may be poorly absorbed at high doses. Understanding recommended ranges and choosing formulations that are appropriate for older adults can make a meaningful difference in both safety and effectiveness. Reading labels carefully and avoiding exaggerated claims helps keep expectations grounded. Quality also varies widely among products. Not all supplements are manufactured to the same standards, and price alone is not always an indicator of quality. Looking for reputable brands, third-party testing, and clear ingredient lists can help reduce uncertainty. Consistency matters more than novelty. and choosing something reliable is often more beneficial than chasing the latest trend. Another practical consideration is timing and routine. Vitamins tend to work best when taken consistently and as part of daily habits rather than sporadically. Pairing them with meals or existing routines can improve absorption and make them easier to remember. Small, sustainable habits are more effective over time than short bursts of enthusiasm followed by inconsistency. What ultimately matters most is understanding that nerve health after 60 is influenced by many interconnected factors. Nutrition, movement, circulation, sleep, and medication management all play a role. A vitamin can be one piece of that larger picture, but it should never be viewed in isolation. Approaching the decision thoughtfully with clear information and realistic expectations helps seniors feel more confident and in control rather than pressured or misled. When choices are made calmly and deliberately, they are more likely to support long-term comfort and stability without creating unnecessary worry or false hope about outcomes that no single supplement can guarantee on its own. For many older adults, the most meaningful changes come not from dramatic interventions, but from small adjustments made with better understanding. Nerve health is often viewed as something that suddenly declines, but in reality, it tends to reflect years of accumulated habits, exposures, and biological changes. When people begin to look at the issue through this broader lens, it becomes easier to see why supportive steps taken earlier can influence how the body feels later on. One important aspect of managing nerve health is recognizing patterns rather than isolated moments. Sensations that fluctuate throughout the day, feel worse at night, or change with activity can provide clues about how nerves are responding to internal and external factors. Paying attention to these patterns helps individuals better understand their own bodies and communicate more clearly with healthcare providers. This awareness can lead to more productive conversations and more personalized guidance. Lifestyle choices continue to matter well into older age. Gentle, regular movement supports circulation, which helps deliver oxygen and nutrients to nerve tissue. Simple activities such as walking, stretching, or balance exercises can promote better nerve signaling over time. Movement also supports muscle strength and joint stability, which can reduce mechanical stress on nerves and lower the risk of irritation. Sleep quality plays a role as well. During rest, the body carries out repair and maintenance processes that are essential for nerve function. Poor or disrupted sleep can amplify discomfort and make sensations feel more intense than they otherwise would. Creating a consistent sleep routine, reducing nighttime disruptions, and addressing sleep issues when they arise can contribute to overall nerve stability. Nutrition remains a foundational factor. Balanced meals that provide a variety of nutrients help support the complex processes involved in nerve signaling and repair. Hydration also matters, as dehydration can affect circulation and nerve sensitivity. While no single food or supplement is a solution on its own, steady, consistent nutritional support can make the nervous system more resilient over time. Equally important is mindset. Many seniors are told to simply accept discomfort as an inevitable part of aging. While some changes are natural, resignation can prevent people from seeking information or making adjustments that might improve their quality of life. Staying curious, asking questions, and learning how different factors influence nerve health can be empowering rather than overwhelming. Ultimately, managing nerve health after 60 is about realistic expectations and long-term thinking. It is not about chasing quick fixes or dramatic promises, but about understanding how small supportive choices can add up. When older adults approach the issue with patience and clarity, they are better positioned to make decisions that align with their needs, values, and overall well-being. This steady, informed approach helps hate a sense of control and confidence, allowing people to focus less on what might be declining and more on what can still be supported and maintained as part of a balanced, thoughtful approach to aging that respects the body's limits while still working with it rather than against it. As we wrap up, the most important thing to remember is that nerve health after 60 is not about fear, blame, or chasing promises that sound too good to be true. It's about understanding how the body changes with time and recognizing that small informed choices can still matter. Aging does not mean giving up control, and it does not mean ignoring signals the body is sending. Information gives you options. Options give you confidence. Whether that means having a better conversation with your doctor, paying closer attention to nutrition, or simply understanding why certain sensations appear. Clarity is always more useful than worry. Nothing discussed here is meant to replace medical care, but it can help you ask better questions and make decisions with your eyes open. Every person's situation is different, and what works for one individual may not be right for another. That's why a calm, thoughtful approach is always better than rushing into changes. When you focus on long term support rather than quick fixes, you're more likely to choose what truly fits your life and health needs. If this information helped you see nerve health in a clearer way, take that understanding with you. Use it as a tool, not a rule. Small steps taken consistently and wisely often make the biggest difference over time, especially when they're guided by knowledge rather than pressure or fear.